Hi, everyone. Welcome to another episode of Seco Direct. I'm your host, Dr. Tiwa. And in continuation with the proactive approach to healthcare, after going through routine medical blood tests, today we're going through routine physical exam. So now, what does routine physical exams, what do they entail? So, in terms of routine physical exams, your healthcare provider typically wants to assess your overall health and well being. And this might include checking your vital signs, such as your blood pressure, your heart rate, your temperature, and also to examine different parts of your body. Now, in terms of the physical examination itself, it's usually divided into four parts. We have the inspection, the palpation, the percussion, and the auscultation. Now, in terms of the inspection, the healthcare provider or the physician that is going through this routine physical exam with you usually seeks to see what is wrong with you just from a quick assessment of your body in terms of looking through your head, your eyes, your nose, every part of your body, just to see if there, for instance, if there's a mass in your stomach, if there's any swelling, if there's any redness to any different part of your body, if there's any changes in your eyes or any changes in your nose or your mouth, if you have any sores. So that is typically what the inspection entails, looking through your legs to see if they are swollen, if there is any edema. So when there's any edema in your leg, for instance, we press your foot, and if it has an indentation that doesn't come back quickly, that's when we call it an edema. So that's what the inspection typically entails. Now, what does palpation do? Now, palpation is typically for, let me give you an example for your abdomen. Now, if you are a patient, you go to your physician today and you tell them that, oh, you have an abdominal pain. Now, they'll tell you to lie down on the bed. And then once they seek to touch your belly, when they touch your belly, lightly touch or deeply touch your belly, that is what is called palpation. Now, that palpation can be done not only on your stomach, you can do it for your chest, you can do it, for instance, in terms of breast examinations, you want to check for lumps, palpation is also done. If you want to check for abdominal pain or abdominal swellings, palpations are always done. This just entails making sure to press each part of your body to see if there are any differences. I've given an example of your foot being swollen. Now, if I touch your foot and I see that indentation, that is me doing palpation. So that's the second part of palpation, of physical examination, I mean. Then we go to percussion. Now, what percussion is, it's in a word for people that are familiar with musical instruments. Percussion, it's a thumping sound that you make on the body. Now, we usually have different sounds that each particular organ typically makes. That's why, for instance, if I want to give you an example, we have like the stomach that gives a tympanic sound, or we have the liver that gives a dull sound. Now, I can't create those sounds for you currently. I hope maybe there's something that can be done as I'm saying this. But when we're doing percussion, we try to elicit those sounds. So we look at your liver, for instance. We know how big your liver is normally, what your liver is meant to be in terms of the normal dimensions. So we do the percussion. That percussion, we listen for that sound. We go, because we expect a dull sound to occur every time that we're percussing your liver. Now, if we percuss your liver and the dull sound goes farther than we expect it to be, then we know that maybe your liver is enlarged. So the percussion sound is meant to check if there's any enlargement of any of your organs, any displacement of any of your organs, for instance. Another thing that you can use it to check is if there's any enlargement of your heart, if there's any occlusion in your lungs, for instance. So that is why we do the percussion part. Now, the last part, and the part that you probably are most aware of, is the auscultation. Now, if you go and see the typical medical doctor, you would see them with an instrument called the stethoscope, the one that they put in their ears and have an external part that they put on your body. Now, that stethoscope is usually used to check your sounds, the sounds that your body makes. But this one, it goes directly into the ear. We do not need to elicit it with a percussion metric we use that stethoscope to listen. Now we listen to your lungs. Typically, your lungs have a normal sound. It's called a vesicular sound. The way you breathe, even when you breathe, is normal. You hear it. Just, it's not something that would alarm you. But in terms of conditions like in asthma or congested lungs, for instance, you would hear that panting, that like you hear different sounds that would show to you that this is not the typical breathing sound that you normally have. And that is where the auscultation comes in, because the instrument will pick up those sounds. It can pick up those sounds on your chest, you can pick up those sounds on your back, your lower back, can pick up those sounds in your stomach. So those are the four levels that we usually have to go through when we're performing a physical exam on a patient. Now, how often or should individuals go for routine physical exams? I'd already stated when we were talking about the blood test that 2 times a month is okay. For physical exams, they also depend on the same factors that they depend on when it comes to blood tests: your age, your gender, your medical history, the risk factors for certain diseases. Now, twice a year also would suffice for routine physical examinations, but it depends on how you want to go about it. You can say, okay, you know what, we can do it three times a year when it comes to physical examinations. It's essential to communicate openly with your healthcare provider regarding these thoughts and follow the recommendations that they might give on what you need to do in terms of the frequency of when you should come back to see your healthcare provider. These appointments will provide valuable opportunity for them to assess your health status. Physical exams are very, very beneficial for individuals of every age. Early detection is paramount. I can give an example of the breast examination I gave earlier. If a lump is found during a thorough physical examination, if a lump is found, at least it can be assessed immediately so that it would not progress to anything that would be harmful to you in the long run. So you can also use these physical exams to speak to the healthcare provider, speak to the physician to let them know any symptoms that you might be having, any concerns that you might be having, any things that you want them to key in on, so that they can also be directed to understand what exactly is wrong with you and what you are saying to them. Thank you very much. That's brought us again to the end of another episode of Seco Direct. Thank you for joining us for this episode. And I hope you have found this discussion with routine physical exam very insightful and beneficial for you. I remain your host, Dr. Tiwa. And if you have any questions or any comments, make sure to put them in the comments below, and we'll be sure to reach back to you. Thank you very much for being with us today. Take care and stay well.